Humans thrive on social connection, and we don't thrive just on knowing people. We thrive on these meaningful relationships that we really see, whether it's with an intimate partner, whether it's with a friend or a family member. That's something that we crave. And during COVID-19, it may actually exacerbate this need and this social desire to be with people. Prolonged social isolation in itself has been known to be detrimental to health, so we're more likely to die earlier. But it's also very similar to if you just feel like you're alone. In terms of infectious diseases, we know there have been outbreaks in previous years, but it hasn't really been on a global scale. So what is really interesting is to really understand the level of social restrictions on people's loneliness and their health and well-being, and how that might differ from country to country. Different countries obviously have different experiences, and what we're trying to figure out is whether the more restrictive these social restrictions are, perhaps whether it might negatively affect their mental health and physical health and well-being down the line. We would expect that people of different ages would be coping with the pandemic differently. So for younger people, for example, not having being able to see their friends face to face might actually take a toll on the way they form their relationships, on the way they maintain those relationships. So it may be incredibly stressful for them. And we do know young people have really high social needs. Fortunately, they're also very good at using technology. So, and much more competent and much more comfortable using technology. So I think that's a real plus here, that they are able to have these coping mechanisms that may help almost alleviate the impact. For older people, I think it's particularly hard, and really depending on the circumstances for older people, those who might be living in the community versus a nursing home, we've got to think about how we can better cater to their emotional and social needs. I think the longer or the more prolonged these social restrictions are, the more difficult it is for most people. Some people do report this idea of the changing dynamic for them is also quite stressful. We do know that humans are resilient, and that the COVID-19 really is making us think to be kind of adaptive and kind of to respond quickly.